Good evening, folks, and welcome to Plaque Talk News. I am your host, Hugh Jazz, and we have an interesting installment for you tonight that is all about lymphoma, specifically Hodgkin's lymphoma. We will dive deep into the topic with multiple experts to help us along the way to talk about etiology, historical significance, a real-life case to explain some of the symptoms, and then a little wrap-up from yours truly. Now, let's throw it over to Dr. Han Kology, a certified oncologist, to explain some of the etiologies. Han?
Thanks, Han. So today I'll be teaching you about lymphoma. I know what you might be thinking, cancer of the limbs, and you would be stupidly mistaken. It is actually a cancer of the lymph cells. More specifically, it is caused by a change or mutation in the DNA of a specific type of white blood cell called B lymphocytes. There are actually two different types of lymphoma. There's Hodgkin's lymphoma and non-Hodgkin's lymphoma. If examining the cells and you detect a presence of a specific type of abnormal cell called Reed-Sternberg, the lymphoma is classified as Hodgkin's. Whereas if the Reed-Sternberg cell is not present, the lymphoma is classified as non-Hodgkin's. Some risk factors include age, which is 20 to 30, or after 55, gender, more men get it, and family history. If you've had a family history of lymphoma, then you have a higher chance of getting it. And if you've had the Epstein-Barr virus or HIV, you have a higher chance of getting lymphoma. So the abnormal lymphocytes usually begin to multiply in one or more sites of the body, such as your neck or groin. Over time, it's possible for the abnormal lymphocytes to spread to other parts of your body, such as bone marrow, spleen, liver, and lungs, and skin. Since it is cancer, there's no incubation or activation stages. Now that you know the basics about lymphoma, I need to get back to doing my research. And I'm going to go ahead and take it to John Doe for the history. John?
Thanks, Han. My name is John Doe, and I was brought in to talk to you about the historical significance of Hodgkin's lymphoma. Thomas Hodgkin, who first described the abnormalities in the lymphatic system in 1832. Dr. Thomas Hodgkin, who, during his work as a pathologist at the Guy's Hospital in London, he described young males who died rapidly after a short fever-stricken illness with generalized lymphadenopathy. He then went on to publish a paper on the mysterious deadly disease. No one at the time thought it was significant until Samuel Wilkes published a paper confirming all of Hodgkin's work. I'm really sorry for boring you guys for this past minute or two, but we have a really interesting interview coming up. Hugh? Thanks, John. So today we have a real life story about lymphoma. We have Betsy to describe some of her husband's symptoms. Betsy?
Oh, thank you so much, Hugh, for having me today. I'm just so nervous about my husband, Bob. Just at night I turn around and he's just sweating like a damn dog. I swear, man, it's insane. And I looked it up on the interwebs, and it said he's got something called oral manifestations. And just like ulcerations, he's got so much pain everywhere, just humbling over. I swear, man. I'm like, Bob, are you kidding me? What's going on? He's just got some swelling in these lymph nodes. It's insane. He's got tooth mobility, I believe it's called. I looked that up on Google as well. I swear, it just touches little tooth. God, I swear Bob's like a 5-year-old losing these teeth left and right. He's getting fevers and just like fatigue. He's tired all the time, man. He's just losing weight, dropping 9-10 pounds with just sitting there, man. I swear. Thank you so much, Hugh.
That was interesting. So let's go ahead and wrap this thing up. So, some treatments for lymphoma include chemotherapy, radiation, bone marrow transplant, and immunotherapy drugs. The 5-year survival rate for Hodgkin's lymphoma is 80%, whereas non-Hodgkin's lymphoma is 70%. Since people with lymphoma do, in fact, have cancer, the effect on them is difficult. They often become depressed and anxious. And with treatment of lymphoma, some of the drugs and chemotherapy can cause different problems down the road, such as different types of cancers. Now, the effect on the dental hygiene treatment is basically just watching out for the oral manifestations. This is making sure that they aren't in too much pain from the ulcerations or from the swelling in their mouth. And And if they are actively doing chemotherapy, medical clearance is needed for treatment. And that is all, folks. Thank you so much for getting through that with me. This has been Hugh with Plaque Talk News. Good night.